Welcome to my channel. This is the Diamond Chrysalis, aka Divested Diamonds. This is divestment with purpose, and you have arrived. Greetings and salutations, ladies. Thank you so much for joining me. Thanks for being here today. Please do me a favor and click the like button as you watch this video. Thank you kindly. Welcome back to part 2 of Dr. Jackie's video, in which I ask the question, should Black women forgive Dr. Jackie? For those of you who haven't seen part 1, you may want to go back and watch that first because there's information in that video that you might find interesting. Either way, let's do a quick recap because we shall be going through some of the comments that Black women left on a particular video in response to Dr. Jackie's comments against Black women. Without further ado, let's get started and listen to the following.
I think we can and all should agree that a statement like "Black women cry wolf during pregnancy" is a ridiculous and harmful thing to say. And while that might be the case, statements like this give us an insight into racial gaps in healthcare. So this statement was made by Dr. Jackie Walters, a doctor and reality TV star from the show Married to Medicine. Many creators online have already covered this story really well, and Dr. Jackie eventually issued an apology at the end of 2023. Although we did also see stories from former patients who had a really hard time with her, and those are really difficult to watch. And maybe to some it might be quite surprising that a Black doctor would make such a statement, but to me this is a testament of the pervasiveness of medical racism, so much so that a doctor who may look like me and share my skin tone would make an untrue statement about Black bodies. But it does happen. It's happened to me, and I know it hasn't happened to just me. It's why medical racism is such an issue. It's part of the fabric of many aspects of Western healthcare, and in some aspects it's even the backbone, like gynae for example. See J. Marion Sims. And I'm not making a video like this to put the onus of medical racism on Black doctors like Dr. Jackie. These ideas are so deep-rooted and go far back, but in 2024 we can't afford to let these ideas continue. Ideas like this are why Serena Williams, for example, almost died giving birth to her child because people wouldn't listen to her. Someone who has access to probably the best healthcare someone could get, and we still see a higher Black maternal mortality rate in the UK and the US. Unlearning these ideas and unpracticing these ideas are integral to the survival of Black people in healthcare settings.
Dr. Jackie saying that Black women exaggerate their pain level during pregnancy is one thing. Her apologizing for it is another thing. But seeing Black women come out like, hey, Dr. Jackie ruined my prenatal experience because she didn't listen to me. She traumatized me. This was the most traumatic birth that I've ever had. I got 2 kids later after her. I'd never go back to her again. It's crazy because she was really applying that rhetoric to her job where she takes care of people. It really makes me wonder why people go to the medical field. Like, did she become an OBGYN after she realized that there was something wrong with her? And I use wrong lightly. I'm not even trying to offend her, but what made her come to this field where she's going to turn around and discredit pain level in a serious matter? She definitely fits into the mean girl nurse retort. And I want to say that she also is one of those aunties that people listen to because she might be a little financially stable or have degrees or something and talk low and slow. You can't check her because she's talking low and slow. Whole time she's negating from the point and insulting your intelligence.
Married to Medicine's Dr. Jackie, she's like one of the best OBGYNs in Atlanta. Everyone goes to Dr. Jackie in Atlanta. So she says her cry wolf during pregnancy was taken out of context. So I sat and I watched the video. And I watched her call Black woman dramatic. And as soon as I heard that, I turned the video off. Because I couldn't believe what I was hearing. And I was truly trying to understand what she was trying to say. But it's already hard enough for Black women out here. And as a Black woman herself, I was shocked that she would even say that. Because Black women do go through real things in the hospital. They feel real pain. And sometimes, most of the time, that pain is ignored, which leads to higher death rates during pregnancy for Black women. She came out with this statement. You guys are more than welcome to read it. But in the summary, she's basically saying that everything was taken out of context and that the reason she became an OBGYN was to add more diversity and to basically be an advocate for Black women in this field.
That pretty much sums it up. And underneath this young lady's video, there were plenty of comments from Black women telling their stories of their unfortunate experiences and what had happened to them, and basically given their opinions on the matter. Let's go through some of these comments. The first comment says, "She's never experienced pregnancy or given birth. How do you know? I never liked her. She's an example of jealousy behind the white coat." Next comment. "This is so disappointing and just sad that she's basically using white people rhetoric." Well, it's very strange, especially for a Black woman, to have this kind of mindset. Next comment. "She doesn't even have kids, so how would she know pain in pregnancy?" Wow, she a whole clown. Indeed, this is definitely clown behavior. It reeks gender hater and gender traitor. Next commenter says, "They told me I had acid reflux. I had a golf ball-sized cyst on my ovary. The nurse that saw me was livid." Look, I'm not surprised. That diagnosis is scary. The incompetence is so real. This is why you must never feel bad for not having undying loyalty towards some of these doctors. Don't be afraid of change. If things aren't working out, find someone else. Next commenter says, "My epidural wasn't placed correctly. I kept being told I wasn't in pain." Pause. Isn't it weird how these people measure pain based on their own judgment and not by the person complaining of the pain? How would they know what someone else's pain threshold is? I'm just curious. "I never numbed. My spine," I think that's what she meant to say here. But anyway, she says, "My spine has been messed up since they all ignored me. And herein lies the problem. This is the danger of making such comments, Dr. Jackie. It further reinforces this untrue notion that Black women are either devoid of pain or exaggerate pain. This is sad." The next commenter says, "Boycott Married to Medicine until she's gone. If Black women stood in solidarity, we would make so many wonderful things happen. But look at us, always trying to stab each other in the back, denying each other's pain. And this is why it's very important to find your tribe. Everybody isn't for you. If we came together in solidarity to make this happen, that would send a message to all these Z-listers that spewing this level of harmful poison is never to be tolerated. If she's so willing to be reckless with her words, hit her exactly where it hurts. Her pockets. Maybe next time she'll think twice about being so irresponsible with what she says. But, one can only dream." Next commenter says, "That's sad, because Black women are really so mistreated in medical fields as is. According to Dr. Jackie, all we do is cry wolf. And of course, she knows more about other women's pain than they do, right? Just ridiculous." The next comment was heartbreaking. This was sad. She says, "My mom was told that she had a UTI, urinary tract infection, over and over. She died of uterine cancer. The creator responds and says, 'I'm sorry.' You see, this is what happens when people believe that you're making things up. When a medical professional decides not to listen to the patient's needs, it's hard to determine the right diagnosis, which further puts the patient at risk of infection, escalation of an existing condition, and possibly death. Dr. Jackie made it seem as though the majority of Black women she's encountered are nothing but a bunch of hypochondriacs. This is absolutely unacceptable. And as far as I'm concerned, she needs to be investigated. What she said were more than just comments. These are real people's lives at stake. Now, the next comment was far from shocking. Nakers are just unbelievable. When they're not worrying about Black women's hair, weave, and wigs, they are in our spaces and trying to include themselves in matters that don't concern them. Some of you Black males are just simply disgusting. Your inability to read the room and exhibit some level of intelligence is something you always fail to do. Your self-absorbed nature just won't allow you to do that. Your self-absorbed nature won't allow you to mind your own business. You always have to be the center of attention every single time. Shameless, as always. So here comes Glocktavius swinging his frankenbeans in a female space. Black women are dramatic. Y'all watch nothing but reality TV and internet drama. Hello? Hello? Who asked him? No one asked him for his opinion, but he gave it anyway. He wasn't invited to this all-women's discussion, but his balls were itching and dripping with sweat. His mouth salivating, gagging to say something because a lot of these losers thrive on the little bit of attention they get, even if it's negative. They can't help themselves. They salivate at the chance to produce verbal diarrhea. So, of course, he asked for attention and got it. And his little peen shriveled once he got called out. Someone responded to him and said, "Oh, so you are an uneducated Black man. We feel pain, but why explain when you can't even open your legs to push out a baby? Have several seats, Dusty." He tucks his little tail between his legs and comes back with this. Never said any of those things you accuse me of. I just said y'all dramatic. I know y'all feel pain, except when it comes to male bashing. Also, I'm very intelligent. Far from Dusty. Clearly, sir, you're not that smart. You are not intelligent at all. Here's the thing. You came into a space where women were discussing a very deep and very serious topic, and you chose to make it about you. Isn't that typical? No XY was hurt. No XY was bashed. This, my friend, was a penis-free zone. But you chose to drag your ghoulies into a space that you didn't belong. And what? You expected not to be checked? There were a couple of further responses here. Someone said, "Nope, she had Dusty down to a T." Another person said, "Stop with the generalizations. How dare you?" Indeed, this is also part of the reason majority of Black males are failures in life. Your priorities are non-existent, unless, of course, you're talking about sex and women. Most of you lack comprehension and discernment. This was not the place or the time to talk about your grievances. There was something more important going on here, and this ninja couldn't help himself but bring his simple mind to the conversation. Very unbecoming. But such is the case with a lot of them. You need to go and speak to your buddy Tyrese and ask him why he would rather be Latino than a Black American male. That's a real conversation right there. You're not needed here. This was a female space. XX, not XY. There is no Y in woman. You all just keep embarrassing yourselves every chance you get. So pathetic. You will sit online and talk a lot of shit about Black women. But guess what? We don't care. Your opinion does not matter. When it comes to women's reproduction, you, my friend, have nothing to do with it. Stay in your lane and leave us alone. And you see, this is why a lot of you will perish alone, broke, fat, old, and alone. Most women today would rather be alone than be with the likes of you. You can't even do the basics such as offer solutions to an issue. Oh no, you had to make yourself the issue. The world does not revolve around you. Everything in life isn't about you. And smart, intelligent, and educated Black women are certainly not here to stroke your egos. You know, Black women are always going through something. Whether or not people choose to see it is up to them. The proof is everywhere. This is not me crying victimhood. We're not victims. We're survivors. However, as you saw in the first part of this video, the world has benefited tremendously off of the pain and suffering of Black women. What Dr. Jackie said was wrong. She painted a picture of Black women being these whiny people who complain simply for the sake of it. This is why we must all be careful when choosing our healthcare professionals, because goodness knows they're not all created equal. We also need to be careful not to pedestalize individuals simply based on what they do for a living. Like this man on the screen. Most people think he's smart. And look, as an astrophysicist, I'm sure he's good at what he does. But every single time he opens his mouth, I have to wonder about that. But I digress. I don't know about you, but I vet my doctors as much as I can before investing my time, effort, and energy into that relationship. I want to know which educational institution they attended. I want to know when they graduated, how old they are, because I have a preference. I don't want them too young, and I certainly don't want them too old. I want them to have some level of experience at least, so I would like for them to be somewhere in the middle. In addition to that, I also want to know if they have any malpractice lawsuits. If they do, that's a no for me. And here's another thing. We hardly look at these situations as relationships, but they are. These people get to know some of the most intimate information about us. Personal information that we normally wouldn't share with just anyone. It's important that the relationship is solid and that they can be trusted with your sensitive information. Well, I use trust very loosely here. You know what I mean. I think that sometimes we forget that doctors work for us. Their job is to cater to our well-being in said profession. And a little sensitivity, professionalism, and respect goes a long way. We also need to bear in mind that not all of them will be impeccable at their job. And when someone isn't delivering as they should, you have every right to let go of them and find someone who will. When it comes to doctor-patient relationships, it's important that you are happy, comfortable, listened to, respected, and properly cared for. Because behind those credentials and white coats are regular human beings just like everybody else. Some are passionate at what they do and do it well, while others only care about the money and overall lifestyle that their career affords them. No one wants to be treated as though they don't matter. or made to feel as though they are an inconvenience. So when Dr. Jackie calls Black women dramatic and says that all we do is complain, complain, and complain, you have to wonder what her motivations are for even doing that job. She certainly doesn't sound like someone who enjoys her career or even fulfilled by it. It boggles the mind. The question still remains, why become an OBGYN if you can't handle it? According to the CDC, Black women are 3 times more likely to meet their demise from a pregnancy-related cause than white women. Multiple factors contribute to these disparities, such as variation in quality health care, underlying chronic conditions, structural racism, and implicit bias. Social determinants of health prevent many people from racial and ethnic minority groups from having fair opportunities for economic, physical, and emotional health. Sadly, Dr. Jackie doesn't believe any of this. I still feel she needs to be investigated based on some of those scathing complaints from her former patients. On that note, what are your thoughts on what's been discussed here today? Please leave your thoughts and comments down below. Don't forget to like, share, and subscribe to the channel. And remember, ladies, the relationship between you and your doctor must always consist of great communication, mutual respect, and trust. Good doctors do exist, but it's up to you to do your due diligence in finding one who will meet your needs. Someone who will not treat you like an inconvenience.
And that you go to the doctor and you complain and you complain and you complain, and you're not taken serious because you cried wolf the entire pregnancy.
You have the right to demand nothing but the best when it comes to your well-being. And sometimes the patient-doctor relationship doesn't work out. But guess what? That's fine. I mean, it's a shame, but certainly not the end of the world. Work on finding someone who will provide you with the care and respect you deserve. We have to remember that not all skin folk are kinfolk. So choose wisely. You shouldn't be relegated to picking someone simply based on skin tone or race. Because let me tell you something. Some of these Black doctors can be just as incompetent and uncaring as everyone else. So my advice to you is do your research and find someone who suits you best. Thank you so much for watching. This is the Diamond Chrysalis. You've been watching Divestment with Purpose. Divest like a butterfly, and I'll see you next time. Bye, diamonds.